public training intended to orient users to the State of Ohio Integrated Behavioral Health Dashboard. While this training is live, it is being recorded, so we can make these videos available for other users. Please feel free to enter your questions in the Zoom chat. Aurelie will help moderate. You can also hold questions for the question and answer session at the end, or submit written questions through our Qualtrics feedback form, and that link will be shared later. My name is Chase. I work for The Ohio State University. I'm a part of the Healing Community Study team that worked with Recovery Ohio and multiple Ohio agencies to develop this dashboard. So what is this dashboard? For the first time, through a collaboration initiated by the Recovery Ohio and the Healing Community Study of Ohio, the state of Ohio is making behavioral health data from multiple agencies accessible in a single location. This dashboard provides a county and state level picture of long-term trends in opioid use disorder, overdoses, and treatment. This dashboard is only in its first phase. We plan to expand and improve it based on data that can be made available and needs expressed by users and potential users. At the end of this presentation, like I said, we'll share a Qualtrics feedback form link and an email address that you can use to let us know how you would like to be able to use the dashboard. The data that can help provide a picture of these trends include counts of drug and opioid overdose deaths, high-risk opioid prescribing, treatment of opioid overdoses by emergency medical services and in hospitals and emergency departments, diagnosis and treatment of opioid use disorder primarily is understood through Medicaid claims data, and Project Dawn naloxone distribution. The dashboard lives on the data.ohio.gov website alongside many of State of Ohio data resources. We will provide the link in the chat. If you have the Monitor real estate, I do encourage you to navigate there so you can try out the features as we go through them in this presentation. The dashboard is available for public use, and with data across all of Ohio's 88 counties, we expect that could be a wide range of stakeholders. Anyone can navigate to this website and see the data without the need to log in. These data can be used to identify challenges involving opioids and opioid use disorder in Ohio, understand opportunities to reduce substance misuse, help counties understand service needs and outcomes, and support funding needs. All right, now we can dive into how to use the dashboard. So let's orient ourselves to what we're seeing and then what we can do to interact with what we're seeing. We'll start on the right where we see the name of the dashboard. This won't change as we interact with it. Below that, we have a banner telling us what type of data we're looking at. I'll refer to this as the measure name, which tells us what type of data we're looking at. And the measure name in this banner will change as we select different measures. Below the banner, we see our graph. This type of graph is called a bar graph because we see values represented by heights of bars. On the left, we see the vertical axis. That one goes up and down. It's often called the y-axis. It's labeled as count, so you know that the number was counted and is not, for example, a percentage or a ratio. On the range of the vertical axis is 0 to a little bit over 5,000. The range of the horizontal axis, also called the x-axis, is in years, from 2017 on the left to 2021 on the right. The bar on the far left is situated directly above the 2017 label on the x-axis. It extends from 0 on the y-axis to almost up to the 5,000 label on the y-axis. That bar itself is labeled with the value it represents, 4,955. By comparison, the bar second to the left is situated directly above 2018 label on the x-axis. It extends from the 0 label to almost up to the 4,000 label and is labeled itself with the value 3,853. So for this measure, we saw a decline from 4,955 drug overdose deaths in 2017 to 3,853 drug overdose deaths in 2018. We can learn more about this drug overdose death measure by looking at the information below the graph. So we'll start at the top and then work down. Measure description describes the graphed data in lay terms. So examples are drug overdose deaths, opioid overdose deaths, Medicaid enrollees with opioid use disorder. Data source indicates the Ohio agency and record type that data are sourced from. So examples are Ohio Department of Health death certificates and Ohio Department of Medicaid claims and enrollment. Values suppressed describes the types of values that are not included in data visualizations, and these suppression rules generally exist to protect confidentiality and are not designed to prevent displaying the volatility that small numbers can produce when viewed across time. Reporting lag estimates the difference between month of dashboard data update and the most recent month of data that are reported. So for example, when the last update is January 2023 and there's a 2-month reporting lag, the most recent month of data will typically be November 2022. You'll notice soon that because of a difference in reporting death data, we happen to be looking at an exception right now. Stability lag estimates when reported values stabilize relative to the month data are updated. So for example, for January 2023 updates and a 6-month stability lag, data values going back to July 2022 are highly likely to change quite a bit, usually to increase. First reported is the earliest month for which data are available. The earliest time for any measure on the dashboard is currently January 2017. Last reported is the most recent month for which data are available, and this can vary between measures based on the reporting agency and the record type that data are sourced from. This is usually the number of reporting lag months prior to the last updated month, but might be earlier when there are special reporting exceptions. So for example, the ODH overdose death data are not currently reported for 2022 until all 2022 values are considered complete or stable. So the last reported month is December 2021. And finally, last updated is the month data were most recently updated on the dashboard. County is the Ohio county represented by the data being viewed, or it'll say all Ohio counties data combined as shown above, or only includes 19 HCS counties for one measure, where HCS is referring to the Healing Communities study that I've mentioned previously. Measure number is the unique code used by the Healing Community study to reference the measure. Age range is the ages of individuals included in the measure count. That's typically 18 years of age or older, or ages 18 to 64 years. And notes includes additional information intended to aid interpretation of measures and their values. All right, now that we have a sense of what information we can find in the graphical and measure information areas, let's look at how we can interact with the dashboard to look at different measures at different levels of detail. Let's orient ourselves to what we're seeing, and then we can interact with it. We'll start from the top and work our way down again. On the left, we have select measurement period, x-axis. So far, we have only seen yearly or annual values, but we can change that to look at quarterly values. And now we see 4 quarters per year. Or we can select the monthly value option to see 12 months of data per year. Notice that because we now have so many bars on the graph, not every bar has a label on the x-axis, and the labels are offset from the bars. We'll still see the month-to-month trends, but we'll see shortly how to get a more careful look at monthly data if you need to zoom in on these values. Before we zoom in on monthly values, let's check out the Select County feature. Currently, we have all Ohio counties selected, and we see that reflected in the measure information area. However, we can select any one Ohio county instead. I've selected my home county, Franklin County, for this example. This selection is reflected in the measure information area. If you want to see state values with one county excluded, for example, when comparing the county to the rest of the state without the influence of that county in the statewide numbers, the exclude values feature is available. However, it's important to note that in this relatively rare case, you need to keep an eye on both the county selected and the county information in the measure information box. In this case, the data show all Ohio counties selected, and the Select County feature shows us that Franklin County is the only county not selected. Another change you might notice as you select one or multiple counties is that the vertical axis is no longer ranging up beyond 5,000, like when we were looking at all Ohio drug overdose deaths by year, or even beyond 500, like when we were looking at all Ohio drug overdose deaths by month, but instead maxes out at 100 because we're now only looking at drug overdose deaths per month that occurred in Ohio among residents of one county, not residents of all Ohio counties or across a whole year. So let's look at what happens when we limit our view to that 1 year. This can be helpful if you want to zoom in on monthly values. All right, I sneakily returned to the all Ohio counties option. Now let's look at the select year functionality. As we noted before in the monthly data view, numbers can get a bit crowded if you're looking at a lot of values at once. If you want to view 1 year, press the select year drop-down menu, select a calendar year. We can see in the select year box, I've selected 2017. And we can clearly see each month's label and the value for the month on the x-axis. All right, now I've hopped back to a statewide view, monthly data across multiple years. So now we can start to talk about how to view different measures. So the State of Ohio Integrated Behavioral Health Dashboard has dozens of measures broken down into 6 categories that reflect the origins of the dashboard as part of the Healing Community Study, which has sought to reduce opioid-related deaths through data-driven community selection and implementation of evidence-based practices related to these categories. So the current categories are overdose and overdose deaths, opioid overdose education and naloxone distribution, or OEND, medication for OUD, or medication-assisted treatment, retention, and ASAM, where ASAM refers to the American Society of Addiction Medicine levels of care, medication for OUD, medication-assisted treatment with treatment as response, safer prescribing, and general community health and demographics. The measure category you select above determines which list of measures you see below. The measure you select below will be the data you get to see. In this case, we have selected drug overdose deaths, so we see the name of the selected measure in the banner over the graph. If I change categories, no measure from the new set of options is automatically selected. So I see the banner for the last measure I selected still, but a message that says that data are not available for the selected measurement period. This is the standard error message that's intended for the most common scenario in which you're going to see data after selecting a measure. We have annual data for all measures, quarterly data for most measures. Many measures are not reported at the monthly level, and so we will see this message again. For now, though, I can move past this error simply by selecting a measure under Select Measure Name. All right, now that I have a measure selected, I see the new banner with the measure name I've selected and plenty of data graphed. But if I select most measures that focused on Medicaid enrollees, I will get the data not available message again, because these data are reported at the quarterly and yearly levels only. So I need to change my selection under the Select Measurement Period x-axis to see the data graphed for me. And now we can see the quarterly data that are available. Finally, we can click a button at the bottom of the screen that will take us to a table of terms. This table is broken down into data-related terms like x-axis and count, as well as content terms like buprenorphine and OD. To return back to the graphs from this slide, make sure to use the Click to Return to Main Dashboard button above the table. The back button on your browser will take you to whatever website you were at before navigating to data.ohio.gov. And that concludes this presentation of the Integrated Behavioral Health Dashboard. You might have noticed that some capabilities were not explored, like downloading the data or selecting a few counties at a time. And that's because those are not current offerings of the Integrated Behavioral Health Dashboard. I'll open the meeting up to questions and discussion now, but I'll have Areli share this link and email address in the chat. Please use these to provide written feedback, to ask questions, and please remember, this dashboard is a work in progress. We want to understand how it can best serve Ohio, and your feedback and ideas are key to that.
All right, there's already a few questions. The first one was if you could see multiple counties, which you just answered. So the next question was, is it possible to select data by subgroups and regions?
Currently, that is not something that you can do on the dashboard. However, what would be absolutely wonderful is if you're able to go to this Qualtrics form or write an email to this email address, is to let us know specifically what you would like to be able to do with functionality like that. What kind of regional groupings, how would you like to be able to use that? And that could help us plan how and whether we can offer that in the future.
There's another question that says, are you able to filter by age at all, or is it all 18 plus?
Currently, the dashboard is limited to 18 and older, and in some cases, ages 18 to 64. Within that, there are not further breakdowns of age. And if they're, I think a lot of my answers might end with, if you have interest in data that extend beyond what is currently offered on the dashboard, or breakdowns of the data that are on the dashboard, that's the type of feedback we would love to be hearing either via the Qualtrics form or email.
Regarding the age groups, you just answered if there was data for all age groups. Why does the age data stop at 64?
In the cases that it stops at age 64, that has to do with decisions that were made in the Healing Community Study. So because this dashboard is based on a template that was created for one very particular purpose, there are decisions that were made that were pretty specific to that study. In particular, I mentioned Healing Community Study of Ohio. It's a study that spans 4 states, and in each of those states there are different ways that data are collected and that were available for comparison across those states. And in trying to find a common data model, we made selections that included some age restrictions for some of the data.
Samantha asked, does it have to do with Medicare eligibility starting at age 65?
That was part of what informed that decision. Yep. And that's why the age 18 to 64 is specific to data that are from Ohio Department of Medicaid.
Is there an ETA for the ability to download data?
I would have to turn that over to our state partners. Erin, are you available to direct that?
I am. Can you hear me?
Yes, we can.
Thank you. We actually have a limited ability to do that with some of the data sets. So for a number of these data sets, it's the first time they've ever been available publicly. And while we're excited to make those all available publicly, part of our ability to do that hinged on not making the data downloadable.
Thank you so much.
There is a question in Qualtrics, which is great. It appears that the dashboard includes only addiction/OUD categories. Will it expand to include mental health?
And you can probably tell by the name of the dashboard that there is a desire to expand beyond focus on opioid use disorder. And that is one reason we want feedback on understanding, what are going to be the high impact ways that we can expand this. And so if you have ideas for specifically what types of measures you would be able to make use of, should they be available on this dashboard and in this environment, we would love to have you share that.
Those are all the questions. Oh, will you share the dashboard? I got it. Those are all the questions that have come in so far. We do have a community member, I believe, today.
Oh my goodness. I believe it's Ryan McMaster.
Yes.
Ryan, I am so sorry that I forgot to introduce you at the beginning. I got so excited to dive into my presentation.
It's
Welcome,
totally
Ryan.
fine. Yeah, you don't have to introduce me at all. Yeah. Thank you. I'm
Um,
here. Yes, I'm here.
Yeah, can I have you introduce yourself? And I'll
Sure.
just let everyone know we have Ryan here because we want people with experience to be able to available for you to ask questions of who have used this dashboard as a part of their participation in healing community study efforts prior to
Yeah,
this. Go
sure.
ahead, Ryan.
All right. Yeah, hi, everybody. Some of you I probably bumped into over the last several years, probably online more than anything. But I work at Case Western Reserve University at the Begun Center for Violence Prevention. And so I'm in Cuyahoga County in Cleveland. And we partnered with the Board of Health here in Cuyahoga County at the beginning of the CDC funded Overdose Data to Action grant, which was really kind of starting around the same time as the Healing Community Study work. And as part of my effort to support the Board of Health, I'm a research data manager, and I worked in narcotics work and in law enforcement for a lot of years as well prior to coming to Case. And to support the work of the Board of Health, we started doing drug overdose work, primarily public health surveillance, as part of my effort to help the Overdose Data to Action grant in the county. And so in doing that, kind of the standard now is to produce dashboards of information that are interactive, just like you've seen here. And so we were trying to do that in Cuyahoga County, which, you know, the issue in the county varies drastically from this outside of the city of Cleveland to the, you know, kind of surrounding suburbs and then out to the more rural areas. So the story is very different depending on where you go. And so we were trying to collect all kinds of metrics to understand what the trends had been and where to focus time, energy, resources specifically in our county. And we discovered very early on that it was pretty challenging to find standard metrics that were reported across the state to even be able to compare ourselves with what was going on in other counties. So I might just cut it short. I could talk all day about this. We've been doing this for several years now, but the HCS group put online essentially the same dashboard that you're seeing now. And we started using some of the measures that are reported in there as some of our baseline measures to measure long-term outcomes for the work that we're trying to do here in the county. And there's a lot of really creative ways I think that you can use the data, like EMS data, for example, over time. Just understanding how many overdoses are occurring in your county in general can be very helpful, understanding the trend, but integrating that with other data that's available across the state can also be very helpful. So I mean, I could go on forever, but there are a variety. I'll just say that there are a variety of other state dashboards or information that's available from other agencies that I'm hoping will be incorporated into this one dashboard. But things like the PDMP data from the Board of Pharmacy, the naloxone administration data from state EMS that's collected at the county level, all this stuff is collected at the county level. If you start to get creative and integrate this stuff, you can really get a good sense of what's been going on in your county, what's currently happening, and potentially what you may be looking at in the future.
Certainly hope.
While you were talking, now there's multiple questions. Is the naloxone administration data per event or per administration?
So I won't answer for the healing. I don't want to answer for, the new integrated behavioral health dashboard. I'm pretty sure I know the answer to that. It's an event, I believe. Correct me if I'm wrong. But the other data that's available from the state EMS, which you can actually kind of compare with, is the number of doses administered by EMS. So if you take those two individual data sets and you potentially combine those, you can get a little bit of an understanding. And there's some limitations with the data because not every incident is reported, but even if you were interested in looking at over time how many naloxone administrations or how many doses have increased per event, those are the types of things you can do to get somewhat creative.
Chase, you might be able to help with this one. Why can't I see the number of ODs treated in hospital EDs for my counties?
Thank you for asking. I can tell you it's because you're not in HCS counties. That's the one measure for which the data that are currently available on this dashboard, instead of being available for all 88 counties, are available for the 19 HCS counties. And if you go to the, you press that terms button.
Chase, sorry, not to interrupt. You sound kind of far away. We're having some
no.
trouble hearing. Oh, now you're
Okay.
close. There we
Yay.
go.
Sorry
Yeah.
about that. I'll start over. So the number of ODs treated in hospital or emergency departments is the only measure for which we're limited to having data for the Healing Communities Study counties. And if you go to the terms button, those counties are listed out in the table of terms.
I will say though that the ODH, this is Ryan again, the ODH puts ED visits for suspected drug overdose by county on another. That's kind of what I was referring to there. You know, there are a variety of places that you can go to see that data specific to any county.
And I know it takes some people a little while to formulate their questions. So I just want to let you know that we're going to hang out here for a little bit and let people keep coming up with questions. But I don't want people to think that the silence means that something's wrong with their computer.
I just posted the ED visit data that's published by ODH. It's a lot of acronyms. The emergency department visit for suspected overdose.
Thank you so much for sharing that.
There's a question that says, could there be an opportunity to include juvenile justice data in this dashboard?
From my perspective, my first thought is consistently going to be, we'd love to hear your ideas for including that in the dashboard. I don't know if we have any state partners who would want to comment further on that in particular who are on the call. But in general, if something's not there and you see an opportunity, if we had it there, then please, head over to that Qualtrics feedback form and let us know, what are the data and how would you like to be able to use it? Why would it be a benefit to have on this statewide dashboard environment?
Chase, this is Erin again. Just to kind of dovetail off of what you just said. Again, this is, and I know you made a reference about this earlier, just phase one. We wanted to make sure that we got data available, but it's phase one of multiple phases that we expect moving forward. So this is only the beginning, and we do want to include additional data sets. I think it's really important to that end to echo Chase's sentiment for folks to provide us feedback on what they think would be useful as part of the dashboard. But while I don't want to make a commitment, it's not outside the realm of possibilities. It's certainly something that we can take under consideration.
Will a video of this training be available to share with others?
We will be posting training videos. So the recordings are providing an opportunity to do that.
What's the difference between MOUD as a response versus retention and ASAM?
Thank you. So again, these were, we found that our MOUD measures, that was a long list of measures. And so it's because these what we call buckets or measure categories were part of how the Healing Community Study was organizing the data that maybe is not going to be the forever organization of the data. So breaking up the MOUD data, we looked at the retention, and ASAM was a lot more about how many people are in treatment programs and being retained for 6 months or longer. And that was for both MOUD and I think the behavioral treatment measures. And then the as response was more of a, that set of measures is more frequently going to be if an overdose is seen in an emergency department, how many of those individuals are then linked to MOUD within 31 days, for example. And so that's the kind of as response piece.
Regarding those video trainings, where and when, sorry, will the trainings be posted?
I think that is a question for me to punt to you, Erin. Does that sound right?
Where will they be posted? We'll be making them available along, I believe, on the details page of the dashboard. I don't have the ones, I just went to go check to see if the one from last week or 2 weeks ago now is available. It is not yet available, but I'll follow up on that to see when that's going to be available, and we'll have some more answers for everybody.
Here's a question. You may have already answered this, but are the OD death data only those deemed accidental or any intent?
Great question. For the healing community study, the definition used included all. So accidental, intentional, and not determined. I don't remember the exact phrase for that one. And I think that brings up a really good point that in general, you might see slightly different numbers for otherwise very similar measures based on small differences in definitions. So, age ranges included. In our case, the deaths are deaths that occurred in Ohio, and then they are assigned to the county of residence. So you might, for example, be looking at these numbers and be comparing them to numbers that you have locally that might report deaths that occur in the county, regardless of residence of the decedent. And so, yeah, really wonderful question to help understand these data. So I see this most recent question. Will the transcript be made available so we can have questions and answers that have been asked answered? So rather than maybe relying on exactly a transcript, I think that we will compile those as, even if they're only asked once, maybe frequently asked questions, which is where the frequently asked questions slide that is now on the presentation came from. And those will be integrated so that each future presentation will be informed by questions that have been asked previously. And then hopefully by the time we get to the end of this, we'll have a really good set of questions and answers. But we'll also use feedback and questions that we get via Qualtrics to inform those. And I see the next question, is there an intent to include data for under 18 years old eventually? And I can send that over to you, Erin, but in the meantime, I think that we will certainly create a lot of intent around where there is demand and where potential users and users demonstrate, this would be the value if we could include this, and that would help us direct efforts into those, highest effective changes that we could make.
So Chase, yes, there's intent to include data for under 18 years old eventually. So that's one of the early priorities in our phasing approach. So we're hoping in phase 2 to give folks a preview. And I think there's been some public comments about this. I don't think I'm letting the cat out of the bag too early here.
I was going to make sure you were the one to say it, though, just in case.
That we would like to include all available ages, and also we would like to expand from OUD to SUD.
I'm going to put out a last call for questions. This was scheduled to go until 1 o'clock, but with quite a bit of silence and people leaving, I don't want to take up time unnecessarily. So why don't we take another 3 minutes if you have more questions you'd like to ask during the live session. But of course, with the Qualtrics form and email, hopefully if you have any remaining questions, you'll still be able to get in touch with us. And thank you so much all for coming and for your great questions.
There is another question in the chat. I don't know if you can see it, Chase. Are there plans to obtain retention and care measures for all players, not just Medicaid? Payers, not players, sorry.
Everyone who's playing this game. There is not a single payer like data system to draw from in Ohio currently. So if there were, the reliance on Medicaid is because it was about as close as we could get in Ohio. I don't know if you have any further insights into that one, Erin. I don't think I do.
I can't answer that question any better than you. You just did.
Okay.
I thought you gave an excellent response.
All right, and with that, we will wrap up for today. Thank you so much for coming. And for those of you who are still around, might still have questions, we look forward to hearing from you on the Qualtrics forum or email.